Could physiotherapy or sports therapy be the key to improvement on your health and fitness path? If you're continuing to push forward with the same old solutions because it's what people do, and you're frequently hitting points of frustration or stagnation, then it may be time to consider alternatives. And today, I'm going to offer the idea of working with a physio or a sports therapist. What's the difference between the services? How do you know which, if any, would be worth investing in? What benefits could you expect to discover? And why you might want to consider these services even if you are not injured or suffering with pain. And by the end of this video, you should have a much better understanding as to whether a sports therapist or physiotherapist could benefit you. And we're starting right now. In previous videos, I've looked at a few alternatives to a simple gym membership, and whilst many of the options I'm offering may well have been on your radar, chances are working with a sports or physiotherapist is something you would only consider if you were injured or in pain. But given we're talking about experts in the physical operations of your body on a muscular and skeletal level, and often beyond, perhaps there are advantages to be gained here you may not have previously thought of. But before we get to that, let's cover one of the most basic questions. This video is lumping sports therapy and physiotherapy together, which is common practice for most people. They do similar things, have similar skill sets and knowledge. They both deal with pain limitations in the joints and muscles. They're both able to create treatments and exercise plans specific to the individual to move towards reduction or ideally elimination of pain. In both instances, they can assess and diagnose injuries, and they can both perform soft tissue treatment, whether that be massage, manual therapy, or exercise. So far, so similar. It's not difficult to see why this happens, so what's the difference between a sports therapist and a physiotherapist? Because we're talking about the services of individuals, as we'll see shortly, it can be very difficult to give absolutes when it comes to the differences between the two. After all, a physiotherapist may choose to focus on the specialisms more commonly associated with a sports therapist and vice versa. But as there are commonly held beliefs in the separation between the two specialisms, it's worth starting there. Commonly, physiotherapists are associated with hospital and medical treatments. As a rule, they have a much broader range of skill sets than sports therapists, including expertise in neurology, respiratory and cardiovascular conditions. This makes them a good choice for patients suffering with multiple conditions. Sports therapists, on the other hand, tend to work in sports environments and predominantly focus more exclusively on musculoskeletal conditions, though many physios also have specialist experience in that area. So it makes them ideal for preventing sports injuries through specific strengthening programs. In a broad sense, you would likely book a sports therapist for injury rehabilitation or prevention when it comes to how you perform during sporting activities or exercise, whereas a physiotherapist would be the go-to when dealing with injury or prevention of injury that affects your function in everyday life. Commonly, a physiotherapist is someone you would see for more of an overview and subsequent check-ins, rather than a weekly, bi-weekly or monthly event. Whereas a sports therapist is someone that's more frequently booked regularly for a sports massage to free up niggles and tensions and essentially keep you in good order, especially if you're a regular gym goer or partake in competitive sports. A physiotherapist is someone you may well be referred to by your doctor or medical practitioner, and private medical insurance can cover the cost of seeing a physiotherapist, or in certain instances it may be covered under NHS treatment. However, it's highly unlikely your insurance will cover the cost of seeing a sports therapist. Hey, you've got this far, so you must be finding something interesting. So how about checking out the range of motion on your thumb or your mouse hand and giving that like button a click? What about qualifications and authoritative titles? Well, the title sports therapist is not a regulated profession in the UK. This means that anyone can call themselves a sports therapist. As I mentioned when discussing the option of working with a personal trainer though, a qualification is no guarantee of quality. However, unlike personal trainers, it's unlikely that a sports therapist will obtain a qualification level without a good baseline knowledge of the musculoskeletal system and a comprehensive level of practical experience. And as manipulation of your possibly already damaged system is part of the process, I'd strongly advise you ensure they know what they're doing, and that they have appropriate insurance to back this up. Physiotherapy, on the other hand, is regulated by the HCPC, Health and Care Professions Council. meaning you can have a little more confidence that if somebody is practicing as a physio, they're doing so within the boundaries and preset standards of the profession. But a physio can also be chartered. Is that something you should look out for? To be chartered, a physiotherapist must be a full member of the Chartered Society of Physiotherapy, CSP. But in the end, that's little more than a paid up membership of a club. It does nothing to improve the quality of service being provided. To achieve that level, the therapist must have successfully completed an undergraduate or accelerated postgraduate degree that's been approved by the HCPC. So in that sense, it gives comfort that the therapist has at least a reasonable level of qualification. And although there is a little more technicality and less personality to this service than, say, a personal trainer, it remains true that two people could have the same level of qualification, but one is more intuitive, focused, passionate, and analytical than the other. And if that person has not chosen to pay the membership fee, but the other has, that does not suddenly create a shift in the quality of service. Okay, you get the picture. People are different from one another, meaning they will bring different things to the table. And so, it's always worth assessing the person, their values, skill sets, and experience, rather than their title or qualifications. But the purpose of this video was to assess the benefits of working with one of these specialists for the furtherment of your fitness endeavours. Why would I even suggest that as an option? As we've discussed, commonly the reason for seeking treatment from either is because of injury or limitation that you need addressed. Well, just because you don't feel physical pain or consistent pain, it doesn't mean you have no limitations to address. It doesn't mean you have no injuries either. You may just not be aware of them. But regardless, prevention is always better than the cure. So if there's something you can do now that will prevent injury and setback later, wouldn't that be worth considering? As sports therapist Beth Vance puts it, treat your muscles the same way you treat your teeth. You brush your teeth every day to stop plaque building up, the same goes for tension in the muscles. The fact is, no one's perfect. What I mean by that is, the definition of what constitutes perfect posture, correct alignment, or symmetry and balance is not something any of us possess. We all have areas that deviate from what constitutes correct posture, or the norm. And over time, we add to these issues through poor sitting positions, bad standing habits, strange sleeping habits, fashion over function choices, or how we use technology, to the point that weak core muscles, rounded shoulders, misaligned hips, or tight ankles are all too common. So when we attempt to make improvements to our health and fitness through sport, exercise, or any other challenging physical activity, these issues become amplified. At best, this means we're held back in our endeavours as we can't optimally perform the physical actions required of us, but it could lead to greater issues by increasing the level of imbalance, causing injury, or in extreme cases, permanent damage. When I work with one-to-one coaching clients, we always review movement, posture, imbalances, range of motion, and foundational strength before considering any exercise program or activities. We do this in parallel with ensuring the goals we're working towards have purpose, align with their personal values, and have clarity. By doing this, it ensures my clients are in a strong position to remove any obstacles in their way, leaving a direct path from where they are currently to where they truly want to be, in a way that feels good and purposeful. If, however, you are aware that your biggest limitations come from these postural and imbalance issues, then clearly this is where your focus should be, at least until you've sufficiently addressed them to the point that they are no longer impeding your progress. I should stress though, this isn't licensed to use this as an excuse to do nothing with regards to training or exercise. It simply means you would be well advised to give these areas your priority whilst applying some caution to the exercise regimes you are including. So, if, on review, you feel you do have limitations that need addressed, pain or no pain, then working with someone who specialises in the resolution of these issues and who has an in-depth knowledge of human anatomy and the musculoskeletal system is clearly going to benefit you. But what if you don't know if you have issues that require resolution? You don't feel any pain, but you simply don't know if there are any imbalances that require addressing. Then book an appointment for an assessment. I think the idea that this is going to become a regular and therefore expensive or time-consuming practice is what often puts people off the idea of visiting a specialist. And as with every route I've discussed in previous videos, there are warning signs worth looking out for. We've already discussed the fact that qualifications and education are not key factors in determining the value of a practitioner. However, looking into where someone completed their qualifications may be a useful indicator. In the words of Mr. Miyagi,
no such thing bad student, only bad teacher.
Here, that's not so black and white. But as with the personal training qualification discussed in a previous video, some course providers simply want paid and will do the bare minimum required to get their students to qualify, where others work hard at ensuring their students develop good practices and come through the course with a passion and a thirst to continue to develop their skills, techniques, and experience. As an example, through my years as a PT and as a gym owner that provided space for sports and physiotherapists to use, I've known and worked alongside many therapists of varying skill and experience levels. And whilst I've worked with many skilled practitioners who began their journey via different course providers, I did notice that those that I encountered who had come through Western School of Massage in Glasgow all seemed to have a good attitude to their craft. Now, I'm not saying that they are the pinnacle of education. I don't know enough about the options to make a judgment on that. But it was noticeable that I rarely spoke to anyone who had qualified through one of their courses who I would consider a subpar practitioner. So if you can find an educator whose students consistently go on to provide a high quality of service, then you could begin to use a qualification from that establishment or course provider as an indicator of comfort. Like the other options I've discussed, there is always the human aspect. The fact that this is a source of income can, in many cases, lead to the practitioner focusing purely on that, and all too often trying to milk every situation for all they can. A common red flag to me is the selling of blocks. If a therapist starts pushing the idea of a block of 5 or 10 sessions, be wary. It doesn't necessarily mean you should write this off. Just proceed with caution. If what you're being told is that the block of 10 should suffice in resolving your issue, and their standard is to sell blocks of 10, then you should consider looking elsewhere. The reason being, they're trying to sell you something that is comfortable to them. They get to sell you the 10 sessions, which frequently ends up with the promise that just 10 more should do it, which has nothing to do with what you need. It's just what they do to feel comfortable. The truth is, they can't possibly know what is going to be required in your specific circumstances. It could be you only need one session to receive a diagnosis, and from there you're confident enough that you can address it on your own. It may be that you require a level of manipulation over a few weeks to break down some scar tissue, ease an impingement, or develop a suitable level of mind-muscle connection that then allows you to continue the process on your own. Perhaps you want to work based on regular check-ins, advice, and exercises, almost like a regular service. Whether you feel you want to do that once per month, once every couple of months, or even once per year, ultimately this should be down to you. And it should be happening with a level of understanding as to what is best for you, which is why I will always encourage doing this alongside developing clarity in what you're looking to achieve. So yes, if you have an injury and the specialist is suggesting you have to return 3 or 4 times over the coming weeks to allow for sufficient manipulation and focus on the problem to give you the relief you're looking for, then relying on their expertise is prudent. But if you're looking to address imbalances, postural issues and so on for the long-term benefit of your health and fitness program, then this should be a discussion that results in something that works for you. It should not be forcing you into a structure that suits the therapist. I'd also suggest you look at the different skill sets the practitioner advertises. You've heard the phrase jack of all trades, master of none. Well, often this can be the case with physical therapists. If a therapist is advertising sports massage, Indian head massage, kinesiology taping, dry needling, cupping, acupuncture, reflexology, along with mindfulness sessions, aromatherapy sessions, and so on, chances are they've not gone down this road in search of expanded knowledge, but rather as a scattergun approach to finding paying clients, hoping that the more they can do, the more chance there is of finding someone to pay them to do one of them. But this does not lead to mastery, or even often competence in any area. Think of it like going to a restaurant. You could head to your local harvester or pizza parlour and expect to be handed a menu with hundreds of options. But if you want a true dining experience with food prepared by a high-level chef, you would expect a limited menu with each item on it being prepared at the peak of perfection. The only difference being, if you get a badly made pizza, you can send it back. If a physical therapist messes up your body, they could cause damage that you have to live with from that point forwards. Once you know what your issues are, how much assistance you need beyond that point becomes unique to each person. If you've little time to spare but a healthy budget, engaging someone to check in with regularly to set you up with some simple but easily implementable exercises to work on may be ideal. If cost is an issue, so long as you understand the problem, you can research potential solutions yourself. There are some fantastic resources available for this. On YouTube, Bob and Brad are the most famous, in their opinion of course. Their content is extremely well presented and broken down into useful sections within their playlist to ensure you can filter out the unimportant and find what you're looking for. If you prefer shorter form content that gets right to it, you might want to head over to Instagram. And while you're there, don't forget to follow DCSfit. And as is often the case, there are many experts on Instagram giving useless or even detrimental advice, so be wary. But if you're looking for good quality content providers, I can heartily suggest Dr. Caleb Burgess, Dr. Adam McCluskey as the PT Initiative, Dr. Stacey as the Physio Fix, and Mike Reinold. Each of them has fantastic feeds with a wealth of information I'm sure you'll find useful. To be clear, I have no affiliation with any of the experts I've mentioned. I just happen to feel they provide high-level content that is worthy of recommendation. The point that I will continually return to time and again is that when you're looking to make a positive change, it is extremely important that you first have clarity on what your goals truly are. I just want to lose weight, I just want to tone up, or something similarly generic is going to get you nowhere. Be clear on your destination and it becomes easier to plan your route. Then assess the obstacles facing you. In this case, these are physical limitations. If you don't know how to assess these yourself, either do some research, which is possibly more difficult with this element than many of the others I've discussed, and learn how to work it out for yourself. Or book an overview session with a professional. By having that clarity on what obstacles are in your way, combined with the hurdles and obstacles that are unique to your life right now, time, money, deadlines, commitments, etc., you can then assess what assistance would serve you best. And hopefully you can now see that a physiotherapist or a sports therapist could be well placed to assist you. Not only that, but by working with someone on a regular basis, they'll become more in tune with how you function. And so if something does go wrong, you fall or injure yourself in some way, they're in a better position to help and won't be sidetracked by any long-standing issues you have, believing them to be part of this most recent development. I'm not saying this is a must. I'm not even saying it should be in your top 5 options. Only you can answer that. However, if you haven't even considered working with a therapist for fundamental improvements rather than waiting for an injury, then I hope this option is now on your radar for consideration at least. But there are 2 options here, so which is best? As I mentioned, there is no clear-cut answer to that. Even if your goals are sport-specific, you may find a physiotherapist who has a passion for sports performance and has a speciality in this area that rivals all others. By the same token, you may find a sports therapist who has extensive experience in neurological dysfunctions or has a flair for general diagnosis of imbalances. So the answer lies more in the questions you are willing to ask. Viewing research and interviewing is part of the process rather than just blindly paying for a service and then dismissing the practice as a whole after one poorly researched and ultimately bad experience. But if I were to make recommendations, this is how I'd suggest approaching things. If you feel you may have issues that, if allowed to continue, could cause problems in your day-to-day life, a poor spinal alignment, misaligned hips, severely restricted range of motion, etc., then I'd suggest consulting with your GP, or if you have private medical insurance, talk to them. That way you can see if you might be able to receive a referral to a specialist that you don't then have to pay for. Another route would be to find a specialist who is covered by your insurer. Be warned, BUPA are amongst the hardest to become associated with, so if you find someone who is, they're likely to have a lot of experience, but it can also limit your choices severely if that is your insurer of choice. Ask them for a diagnosis and see if that diagnosis will assist in obtaining a referral back to them. If, however, you're looking for a boost to your sporting or athletic prowess, you may want to see if there's a sports therapist associated with your club or training facility. Don't simply hire on that basis, but you can use them as a benchmark when reviewing your options, knowing that if they prove to be a solid choice, They may also be convenient to see in conjunction with your training or competing. The main thing I'd suggest though is not to count anything out immediately. Look for red flags. Request information that shows experience in the fields that are important to you, and ask them to demonstrate knowledge of your requirements, perhaps through case studies. Also, be sure you feel comfortable with them. They're going to have to get up close and personal with you, and the last thing you want is to be clenching from that alone. And don't fall for the sales or marketing gimmicks. I can't ever stress this enough. You have a problem that you wish to resolve. Be clear on what that is. Then look for the services and tools that will help you, and don't be distracted by shiny objects along the way. But if upon review you don't think or are not sure if working with a sports therapist or physiotherapist is a route worth pursuing right now, click here to see if there's anything you might learn from the practice or philosophies of yoga that might benefit your progress. Alternatively, keep an eye out for the future videos where I'll be covering even more options you may not yet have considered.